All right, hello, my name is Aaron and I'm here today with Dr. Nielsen from Kaizen Physical Therapy. Thank you for being here today. I really appreciate you making time for us. I have a few questions for you today, and because I want to share some information about what you do and how you help people. So can you tell us a little bit about your background as a physical therapist and how you got into physical therapy?
Yeah, first, thank you so much for having me. I really do appreciate it coming on here and trying to share my message about how physical therapy can help people. So I came to open up Kaizen Physical Therapy because I was working in, and this is an honest perspective, is I was working in clinics where I was treating 3 or 4 patients at one time. And what I found was that patients weren't getting the outcomes they had wanted and deserved. And I could offer a lot more. So not just were the patients not getting what they deserved, but I found myself getting burnt out and falling into the trap of not caring like I should. And I said, okay, I need to give patients more. How can I do that? And that's when I decided to open up Kaizen Physical Therapy.
Mm-hmm. So when you were feeling burnt out, what was it about working there that you felt like, okay, I can't keep doing this? What was burning you out? How did you feel? It
just always seemed like go, go, go. It was never, it wasn't always about the patient. It was about moving them through. Mm-hmm. It was kind of like an assembly line, if you will. It was pushing people through, and all I had time to do was give people exercise. Now, a lot of people will benefit from just exercise. I like to tell people that there's really 3 pockets of types of patients. There's a type of patient that's going to get better just from some hands-on, can be massage, cupping, myofascial release. Then there's a pocket of patients that'll get better just from exercise. They don't need any of the massage or anything. Then there's a huge pocket of population that they need both. But there's not a provider, or there's not very many providers that are well-trained in movement as well trained in how to provide a solid foundation of hands-on approach.
Yeah. Wow. And then, so from there, you decided, okay, I'm going to open my own business, right? And then, so what is it that your business, Kaizen Physical Therapy, does different or provides in a different way than people might have experienced elsewhere?
So we like to get to the person before they think about pain meds, injections, or surgery, not after. Our typical patient population, now we do see people that have had surgery in the past, but it's usually somebody that doesn't want surgery that comes and sees us, or they don't want pain meds or injections. So we like to be the first line of defense at Kaizen Physical Therapy if we can, as opposed to the last line of defense.
Mm-hmm. So a lot of people think physical therapy is almost, just exercises or post-surgical rehab. How do you explain what you do, what would you say to someone who thought, oh, well, I'm getting surgery next week, I need to find PT after surgery? How would you explain to them, what you do and why they should come see you before surgery, or why someone should consider seeing you before getting a MRI or X-ray?
Yeah, good question. The reason why that is so important is because science has actually shown us time and time again that people that have no pain have the absolute same findings on an X-ray or an MRI as people that have pain. So for example, there have been so many people that have been shown to have arthritis, but they have no pain. Torn rotator cuffs, no pain. Torn meniscus in the knee, no pain. Torn labrums, you name it. All these findings on the X-ray or MRI, yet they have no pain. So we like to get to the person, again, we like to get to them first, because if we're able to assess and look at how they're moving, that'll tell us a lot more typically than what an X-ray or an MRI will.
Mm-hmm. Okay. And then if someone's out there thinking, well, I should go see PT, or maybe I should get a massage, or should I go see my personal trainer? Why would they come see PT, or what are some things that physical therapy can help with that people might not know that physical therapy can help with?
Yeah, so it really comes down to the people that we help have a movement problem. So if there's pain with movement, usually we can help. Mm-hmm. What I mean by that is if sitting feels better than walking, or if laying down feels better than standing, or if running hurts but yet walking is okay. that says to me you've got a movement problem. And that's typically where we fall in line, is we can help people that say I've got pain with movement in certain positions, but then feels a little bit better in other positions.
Okay. And what's a typical treatment like, or what would a person experience if they called you or came in to see you for physical therapy?
Yeah, so a typical treatment, usually we see our patients about once a week. Typical treatment is about 50 minutes in length, and then it usually is about 8 total visits until we're able to get them back to the activity that they want to be doing, whether that's running, walking, CrossFit, or some type of exercise. Usually the patient we do see is somebody that wants to get back to being active. What I have found is that pain, we can deal with pain. At the point that we can't deal with pain is when it stops us from doing something. And those are the people that we help, that want to get back to being active and mobile, whatever that looks like to them.
Right, great. And then what's the patient's role in physical therapy? Is it something you just do to patients and they go home and, like they have nothing to do, or they have exercise to do? Like what's the patient's job in this whole process?
Yeah, they definitely have to invest their time. We can only do so much in the clinic, especially if we're only seeing you once a week. That means that you have to put in your time. It's usually about 30 minutes a day, 30 to 40 minutes a day of your time, 1 to 3 exercises per week. And then you come back in the next week and we reassess, look how you're moving, and then go from there. And typically it's another 1 to 3 different exercises. So I'd say about 30 to 40 minutes a day of you investing your time to get better.
Yeah. What would you say to someone who says, well, I've already tried physical therapy and it didn't work?
I would say, let me look at you, or let Kaizen Physical Therapy look at you. And to show that we really care, we offer people a free visit. It's our full body diagnostic visit. It's about 20 to 30 minutes in length. And it allows us to look at how you're moving, listen to your story a little bit closer, and then see if we can help. And it's no obligation. That's just to show the community how much we really care.
Wow. If someone's interested in coming in to see you for a total body diagnostic or get some other information from you, where do they go?
So they can go directly to our website, and you'll see at the top there's a button that says Total Body Diagnostic. You just click on that and fill that out. They can also call us at the clinic at 919-617-6134.
And if someone's not ready for a total body diagnostic exam or to talk to you yet, but they want some more information, do you have free information, or don't you have like a book on back pain or knee pain on your website?
Yeah, we've got a couple of free books that you'll find on the website as well. There's a back pain, a shoulder pain, and a knee pain. Again, to try and educate people on what the next steps look like, give you a couple things to work on to start getting out of pain immediately. And then if you need some more information, we're here for you.
Okay. And if people are still on the fence about what to do, should I see an orthopedic surgeon? Should I take some pain meds, just even Advil, get a massage or PT? What would you recommend, or what would your best piece of advice be for them?
My best piece of advice would be is it comes down to, do you have a movement problem? So if you have that movement problem, pain with movement, I would say always come to us before undergoing surgery. Or if you don't want to take pain meds, ibuprofen, any of that stuff, always come and see us first. And then that way, because we are totally holistic, where we don't want you to have surgery or have to take pain meds. And then if we can't help you, then we'll help find you what the next step looks like.
Awesome. That's wonderful. Thank you for being here, Dr. Nielsen.
Thank you so much.
Appreciate it.